So today we will have our first speaker. First speaker, Professor Sautel May, well-renowned speaker and researcher in myopia and public health. She will share with us on the topic light outdoors and myopia in children. Professor Saw, please.
Thank you. Thank you for the invitation to speak. It's a very kind introduction from you, Jason. So this symposium is on children's health in regarding the eye, but I will speak on myopia, which is quite a big problem in other parts. I've got some financial disclosures as seen on these slides. So we know that myopia is a disease very common in large urban cities. I think we see that in India as well, and the rest of Asia, for example, in Korea, Japan, Singapore. And we know the burden is huge because it can cause myopic macular degeneration. In Singapore, the myopia rates have been very high for the past 30 years, so for a long time. And the prevalence of myopia in young male adults, because we refracted the military conscripts, is as high as 86%, and it's been remaining about the same, quite stable, maybe a bit lower by now. There have been several studies, so I've been privileged to collaborate with my collaborators from China. So they've looked at 82 studies in China and the pooled prevalence of myopia, and that's all refraction encyclopedia. And we see these rates as a summary. So in children less than 4 years, it's about 2.6%. In children 5 to 9 years, 22%. 10 to 14 years, 45%. And 15 to 19 years is already 67%. And the projection is that the myopia rates will increase in both urban and rural China, although the difference between urban and rural areas has decreased quite a bit, and we will see that increase in the next few decades. We also have seen rising prevalence of myopia for a long time. So for example, these data are from Japan, 1912 to 1937, we see these rising rates. And in Singapore, we see a sudden rapid rise, where it was only about 30–40%, in the 1940s and 1950s. But it's not a gradual rise like in the Western countries. The sudden rise in the 1970s and 80s, and then suddenly it shot up to about 80% in 1996. So with this sudden rise, we see an intergenerational difference in myopia. I'm not sure whether this will happen in other countries where the rise in myopia is more gradual. So I'm going to talk about the environmental risk factors for myopia, but to summarize, there are two major environmental risk factors for myopia. The first, the lack of time outdoors, and the second is too much near work, which could be reading and writing from the paper or reading and writing from the screen, what we call screen time. And of course, the small, tiny, minor genes that may cause myopia as well. And we see here, for example, I'm just going to focus on outdoor time, and we see here in this study by Lisa Jones that, this increase in myopia as they spend less time outdoors. So there's the hours playing sports and how that interacts with the number of myopic parents. And we know from many randomized controlled trials have proven once you have an outdoor intervention that the incidence rate of myopia is lower, and spending more time outdoors doesn't really affect the academic performance of the children. So they're still doing very well in school. So the parents may not have to be concerned about that. And we have got other studies, for example, the study in Shanghai, China, 6,000 children, where in the intervention arm, they spend an extra 40 to 80 minutes outdoors, and the light meter has measured the light levels in lux, and we see that the myopia rates have decreased with this outdoor intervention, and with the outdoor intervention, a higher light level. So I'm going to talk about something more technical now. It's our two inventions. Firstly, we have a fitness tracker, the FitSight, that can document light and outdoor patterns every minute. And secondly, we work to the engineer, and we have developed a child mannequin with a light meter in the eye socket. So starting with the outdoor fitness tracker, we invented that in 2014. So it's a standalone prototype, minute by minute light levels and lux telling us whether the indoor or outdoors, or it can be added to a smartwatch, for example, and an app that can track the light intensity and time outdoors as well. So this is a typical slide of a child, and we see here the time spent indoors in school. The light levels are very low, a few hundred lux. And then when the child is outside during recess, it suddenly shoots up to 26,000 lux. This is when the child is walking home, but the rest of the time, a child in Singapore spends a lot of time at home. So you see the child is watching television and then doing homework and going to the cousin's house for dinner. So in urban countries such as Singapore, we see that the lifestyle is very indoor-centric. And that's a weekday. So you say, oh, that's a weekday, they're hardly outside. Well, that's true. So on the weekend, the children try to bring the children outside. So this is already very good for a Singapore child to be exercising in the park. But the rest of the time when the child is indoors, we see these very low light levels. So the very low light levels are a problem. And we have children wearing the FitSight tracker maybe for 7 days. And we see here that the mean lux level is very low, only 731 lux. And the maximum lux level is only about 31,669. So I'm going to talk about a birth cohort that we launched and the children are about 15 years of age now. We started a birth cohort in Singapore, but at the age of 9, we see that we have used this FitSight watch, and we have a diary and a questionnaire and cycloplegic refraction to look at the relationship between outdoors and myopia. So we see near work, which could be reading, writing, screen time, and this is a distribution. Then we have outdoor time, and we see that variation as well. But we see here, it's not really true. If they spend more time on near work, they will actually spend less time outdoors. We have children, I don't know how they do this, but they spend a lot of time on near work and a lot of time outdoors. And then we have children who don't do anything at all. They hardly are outdoors and hardly do any near work. Maybe they're sleeping. So it's not the inverse relationship, they're both independent factors. And with the diary, we have a clear idea of what they're doing. Most of the time, nothing much. Just you think that they're really doing some vigorous exercise, but the children are quite simple. In Singapore, they're just playing, walking, swimming, because we're a tropical country. And when we look and track the light measures minute by minute, as expected, the light levels are much higher at the noonday. And we found that for every minute and hour increase in outdoor time, regardless of the light levels and the light patterns, the myopia rates will decrease. We also compared our results with the results in Australia. So this is in Brisbane, it's Scott Reed in Brisbane. And then we see across, and they also have a light meter, so across the time of the day, and when we compare the number of spurts, we always see that in Singapore, the outdoor time is always consistently much lower than in Australia. And we know, for example, in Brisbane, that the myopia rates are much lower in Brisbane, Australia. And we're also looking at green space, and this is a study in China looking at myopia rates and green space. And of course, if you're near more green space, then you spend more time outdoors, and myopia rates will be lower. There is also this glass classroom that was invented, and it's in Guangzhou, and we see that the light levels are quite high, but it's not easy to engineer and design. It's very expensive. This sort of classroom where you allow the sunlight to come in and the light levels are higher. We also have got, family walks and all that, nature parks in Singapore, so that's quite successful. And then we have a very good national myopia prevention program by the Ministry of Health to educate and encourage the children. Okay, but if I have time, then I'll just end with this study that was funded by Excellor, but we're looking at, people do ask me, if you ask the children to go outside, what about protection for their eyes against cataract and so forth? Can they still wear sunglasses and hat? And I thought, this is Singapore sky, and we did measure, and this is in the university. So our National University of Singapore, we invented this mannequin with the light meter and the eye socket, and the different environments with the mannequin, and indoors as well. So you get indoors with a big window, or indoors with no window. And we know the difference between indoor lighting and sunlight. So the wavelengths are different and the intensity is much lower indoors. So let's look at the open field where you see these lux levels, very cloudy in Singapore, so across the time of the day, the lux levels, of course, highest in the open field when we place the light meter and the air mannequin, but do they really decrease very much if the child is under a tree? It does, but still higher than the child was indoors. So even a child outdoors under a tree still receives more light and protection from myopia than indoors. And you know, in the street, it's not very different. It's still better than being indoors. And if you wear sunglasses, and this is, you know, the light meter is inside the eye. If you wear sunglasses, we see also that the light entering the eye is better than indoors. So always go outside, wear sunglasses, and that is still better. Even wrap around sunglasses that protects your eye, but at the same time, the light levels entering your eye to protect from myopia are still higher than indoors, and you know, all types of sunglasses work as well. And even if you wear a hat and you wear sunglasses, which is the orange bar, now of course the light levels entering your eye will be less and lower, which is only about 2000 lux. Is still higher than being indoors, because being indoors, the lux levels from these artificial bulbs, the light intensity is very low. I think right now here, it will be a light meter only be about 200 lux. So this is a summary of our results of our study, that being outside, even with sunglasses and hat, is very good for you, and should spend at least 2 to 3 hours per day outside, which is 14 to 21 hours per week. So the message is that children should enjoy the great outdoors and continue. If they're already enjoying the great outdoors, they should continue to enjoy the great outdoors. I'd like to thank all my collaborators. Thank you very much. Thank you.
Thank you, Professor Saw. I think we can take 1 to 2 questions after each talk. Any question for Professor Saw? May I ask Professor Saw, for the outdoor is so important, but in Singapore, I see that there is a lot of outdoor because the sunlight is very shiny. But in some regions, the outdoor is not that much. I mean, the lux is not that much. Some geographical consideration or some seasonal consideration. How should we tackle these measures?
What we have found from the GASO study is all about time. It's a time outdoors, and we don't need very high lux levels. So even though outside it's not very sunny and it's quite cloudy, and the lux levels, even at 2,000 to 3,000 lux, which is not very high, is still better than indoors. So as long as, even I guess if it's a very cold country in winter, as long as they spend some time outdoors during daylight, and even though it may look quite dark with a dark cloud there, it's still, the light levels are still better than indoors. So being outside and out of the walls is still better for the child.
Thank you. And especially in Singapore, the academic stress is so high. I can echo with that, in similar or even stronger than in Hong Kong. So how can you encourage the parents, or from family approach, or from government approach, or school approach for these outdoor activity?
Yeah, I think the outdoor activities have other benefits. For example, the children may be quite stressed, and they might be quite anxious, and they may not have enough time for family bonding. So the outdoor activities improve family bonding, improve the relationship with their parents, spending time outdoors. It also decreases the stress. So if your mental health is better and you're doing well, then you might do better in school. And for the randomized trial in Shanghai, they've shown that they've looked at academic grades. Even if they spend more time outdoors, the academic grades are not affected. And we can see that, for example, in Australia or in the UK, the children are all doing very well, but they're outside as well.
Thank you. Thank you.
Thank you.
Thank you very much.
What is the role of atropine in the case of myopia, especially in the under 13-year age group?
Sorry, can we repeat that again?
Role of atropine in the myopia in under 13-year age. The role of atropine.
Atropine?
Yeah, in the myopic patient under 13-year age group.
Under 13?
Yeah.
So this is, I was talking about prevention, but once a child is myopic, and like you mentioned, below 13 years of age, then one of the treatments that can slow down the progression of myopia is low-dose atropine eye drops, which have fewer side effects as well. So in Singapore, we do prescribe in the hospital myopia clinic low-dose atropine eye drops, but the expert on atropine eye drops is Jason. Yeah, Jason.
Okay, thank you.
Thank you.
Professor Saw, thank you for that wonderful talk. I just had this question, you know, like you presented on the light outdoor impact on the myopia, but in Singapore, did you also have any, you know, I know that the population is quite diverse, Chinese ethnicity versus, you know, different kind of ethnicities. In your data set, whatever you presented, was it mixture of these, or did it have any differentiation between ethnicities?
Yeah, I've shown the data in, I think in military conscripts, we had 15,000 in 1996, and then 20,000 in the year 2000. We have about 78% are Chinese, and then we have a population of Malays and Indians. And we have compared our data on Malaysia in a WHO study. So consistently, in the same country, the rates of myopia are highest in the Chinese, followed by the Indians, and then lowest in the Malays. But the rates in Indians in Singapore is higher than Indians in India, and the rates of myopia rates in Malays in Singapore is higher than in Malaysia. So there's still, because of the environmental influence of the entire country, the rates of myopia are high for all three ethnic groups.
Excuse me, what is the average screen time for the children? Those are the study.
Are you asking about screen
Yeah,
time?
Screen time.
Screen
Average
time, yes.
Does not affect the eye.
Yeah, so screen time, and there's been a large meta-analysis of 300,000 children from many studies. A few meta-analyses have been published, have shown that if children spend too much time on the screen, then the rates of myopia are higher. So we do recommend not more than 1 or 2 hours a day. And if a child is younger, then for example, less than 2 years, we don't even recommend very much screen time. Because the eye is growing and not that mature, it is quite a big problem in some countries, where in the school, also they are switching from reading and writing on paper to digital devices.
Okay.